Hello everyone. So today I'll be talking about ADHD. ADHD means attention deficit hyperactivity disorder. I'll be discussing it based on those terms: definition of ADHD, causes, signs and symptoms, diagnosis, treatment, and living with ADHD. ADHD is a neurodevelopmental disorder that affects one's behavior and its ability to focus or even sit well or concentrate. What are the causes? Causes include there are no single cause actually, but researchers have proven that ADHD can be genetic. It can run in a family, especially when a family member, it could be the one of the parents or any sibling has it. There is possibility that or probability that someone else will have ADHD in the family. Research also has proven that when scan or brain scan of a person with ADHD and a person without ADHD are done, the person with ADHD has a part of the brain that is smaller when in comparison to the other person. Also, research has proven that there's an imbalance in the neurotransmitters of the brain. Neurotransmitters are just chemical messengers that transmit information in the brain. They transmit information between neurons in the brain. We have examples of neurotransmitters like dopamine, epinephrine, serotonin, acetylcholine. These are neurotransmitters. Just like when you touch your hand on a hot surface, and quickly there's a impulse that is transmitted through the neurons to the brain, and brain respond quickly, making you to move your hand immediately from that hot surface. That's the work of a neurotransmitter. So these are the causes, but there are also predisposing factors as well. One of the predisposing factors of ADHD can be a mother who abused drugs or alcohol during pregnancy. It can also be a low-term birth weight. A baby that is born maybe less than 2 kilograms in birth weight can also be a predisposing factor. Another factor could be those with epilepsy, having seizures as well. It could also be severe traumatic brain injury. The traumatic brain injury could be when the baby was in the womb or during delivery, or even after when the person maybe has sustained a road traffic accident that has caused damage in the brain. These are factors that can lead to ADHD. And so, what are the symptoms of somebody having ADHD? Just like the name implies, attention deficit hyperactivity disorder. There are two behaviors that are prominent: inattentiveness, hyperactivity, and also impulsiveness. And in inattentiveness, you see the child with inattentiveness having short attention span. The child cannot concentrate. The child, when you give the child an assignment to do, they cannot finish it because they run from one activity or one task to the other. The child cannot organize things. They cannot organize things. They are running from helter to skelter. When they go to school, they perform poorly because they could not pay attention. And you see the children not focusing on things because they cannot pay attention to things. They tend to forget things. They cannot carry out instructions. They are changing activity frequently. Why the ones with hyperactivity and impulsiveness? This child also cannot concentrate because they are too hyperactive. They're having physical movement, touching their body, but they cannot concentrate at all. They cannot sit one place at all. They tend to fidget. They cannot even follow turns. When they're on a queue like this, they jump off from the queue to enter another queue. They're interrupting conversations because of the impulsiveness nature. They cannot think. They don't think before acting. They can even come where children are playing and disrupt their play. That's their behavior. They have little or no sense to danger. They just like experimenting things, you know. So they even talk a lot, excessive talking. These are signs to know that somebody is having hyperactivity and impulsiveness. Research has proven that two in three or 2 to 3 in 10 persons have inattentiveness. And when they have inattentiveness behavior more prominent, they have this diagnosis called ADD, which is attention deficit disorder. Attention deficit disorder has been proven to be more common in girls. And this could be a result that, girls are usually more on the calmer side when they are, children. They're more on the calmer side than the boys, because the boys like to play a lot, they like to experiment things. And so the diagnosis of ADHD is usually missed in the girls. And because boys are more playful, it has been proven that ADHD is more common in boys. And so, how then do you diagnose ADHD? ADHD is usually diagnosed when the person is a child, usually before 1 year old. Usually, if the parents are observant enough, they would have been able to notice this behavior. But please do not, because children usually are too playful when they are still young, when they are a kid, they are too playful. Do not misjudge it as ADHD. But when this child starts developing and you notice that they are too hyperactive, they cannot pay attention, it's become more prominent, then you need to speak to your GP or to your doctor or to the pediatrician, whichever case it is. And if it is diagnosis is missed as when they were, preschoolers, pre-toddlers, then it could be diagnosed even as a toddler age or even when they are in the school age. When they're in a school age, maybe their school teacher could be able to identify these behaviors and might even inform the parents, or in a school, they have what is called a special education needs coordinator, who will, liaise with the GP or the other health professionals, and they'll be able to make, and with the parents as well, and be able to make a proper diagnosis for the child. ADHD can also be diagnosed at teenage age or even at into adulthood. But before they diagnose ADHD into adulthood, the person, it must not have occurred recently. It must not be behavior that just occurred. No, the proper history will be taken. Even as a child, proper history will be taken. The GP would have asked the parents, when did this behavior start? Has that behavior been consistent? Is this child underperforming in school? Is this child having difficulty with playing with other children? Are they always disrupting other children's behavior? These are questions that the GP or the pediatrician will ask the parents in order to make a proper diagnosis of ADHD. And for the adults, when the diagnosis has been missed during their, school age or the preschool or whatever, then they also ask the adults, because it's a behavior that is not recently started. It's a behavior that is, back during when that person or that adult is a child. And so they will start asking, when do you start developing this behavior? Or how long has it been ongoing? When did it start? When you are in school, they will not ask the person, when you are in school, that's the adults, were you having poor performance in school? Does that behavior affect your academics? Or does it affect you being able to develop a proper relationship? Also, do that adult also drive dangerously? Because somebody that's too hyperactive cannot concentrate in driving. And so if that person has been known for a dangerous driving, it's also an indication to prove that maybe this person is having ADHD. So these are the history that a GP or a doctor or a psychotherapist will carry out to be able to diagnose ADHD. So we've talked about the diagnosis now. How do we manage ADHD? How do somebody with ADHD or treatment of ADHD or management? ADHD can be managed with medications. There are some medications that are prescribed for ADHD, which I'm not going to go into discussion because it's a GP or a doctor that will do the prescription. Then it could also be some therapies. There are different types of therapies that could also be, like psychotherapy. In psychotherapy, psychotherapy is all about encouraging this child or this adult to talk about their fears, talk about how they feel about ADHD. When they talk about it and understand the effect on them, they're able to help them to allay their anxiety, their worries. Because one of the mental health conditions that is closely related to ADHD is anxiety. because the child might see himself or herself, or the adult might see himself or herself as inadequate, somebody that cannot achieve his own goal. He might see himself as having low self-esteem. So with that psychotherapy or psychoeducation, the psychotherapists can be able to talk to them about it, and they'll be able to understand what it is and able to understand how they can manage with it. There's also behavioral therapy. Behavioral therapy is all about watching the child behavior, educating the child, guiding the child, supporting the child on how to behave. It could be that this child cannot sit one place, even for 30 minutes, cannot sit down for 30 minutes without jumping from one pillar to post. So the parents can use what is called a reward system. You might tell the child, okay, let's come and watch this film or this cartoon. And if the child can able to watch that cartoon for like 30 minutes or an hour, you might give that child, use a reward system. You might tell the child, okay, I'll buy you your favorite toy. It could be a doll, anything. I'll buy you your favorite teddy. And they see that child, because of that reward, that child will be able to, cope or manage to sit for an hour. And by so doing, you are trying to improve that child behavior. Another thing is CBT, which is called cognitive behavioral therapy. Cognitive behavioral therapy is a talking system that psychotherapists can use as well. Is to talk that person to how to manage their problems, to change their mindset on how they think. Because some people with ADHD think they cannot properly integrate in the society. They look themselves as, second-class citizens. So when you properly help them to change their mindset, that they can achieve their goal, that they can be a goal-getter, just properly supporting them on how to achieve their goals, how to achieve their dreams will help them a lot with CBT, cognitive behavioral therapy. What about the social skills? Also, because these children or these adults, they do not have a proper social skill. They find it difficult to socialize. They find it difficult to, create a meaningful relationship with people. As a child, as a parent, you need to teach these children how to behave outside, in public. How to, when there is a social gathering, how to behave, not to be disruptive in the public. These are ways you can help them. What about the parents as well? The parent has a role to play as well. The parents also should do what? Engage in a focus group. There's some groups. If you're in the UK, there's a group called AADD. Whatever location you're in the UK, you can join this group. Yes, thereby, when you join this group, or when your GP signposts you to such group, it's not that you're a bad parent, no, but this group will help you to understand how to manage ADHD. Also, to be able to help yourself, because you as a parent might feel overwhelmed. But when you go to the group and you see other parents that have children with ADHD, they relate their experiences. You can learn one thing or the other from them as well on how they manage and be able to cope with ADHD. Because it's necessary that parents follow the instructions of the GP. If these children are prescribed medication, they should administer this medication at the right time as well. Also, if there are instructions or guidance from the school teachers as well, they should follow it, because these school teachers are also important in training these children with ADHD. Another things that could also help with ADHD, research has proven that diet can also help. A diet high in omega-3 and omega-6 is also necessary for the development of their brain. But before you give your child such, you need to speak to a GP who will prescribe such medications. Also, exercise is necessary, or curtailing their excessive exercises or excessive play as well. Also, sleep. It might be difficult to get that child to sleep, like a child that is too hyperactive. You can also use a reward system for them and let that child sleep more, because they are too hyperactive. They might have little sleep, so you encourage them to sleep as well. Okay, these are the ways that you can also manage ADHD, because it's not easy for parents who have children with ADHD. So parents should try as much as possible to understand these children. Praise their strengths. Do not be criticizing them. Understand their behavior. Do not focus on their weakness. Praise them. Encourage them. You can use this reward system. You can use, praises, buying them gifts So encourage them because it's not easy. And if when these children are not, or when they are not properly trained, or when diagnosis is missed, the diagnosis of ADHD is missed, these children might go on to have low self-esteem. These children might go on to become miscreants in the society, engaging in risky behavior. So we don't want that to happen in the society. So this is where I'll be drawing the conclusion of this topic today. I hope you have gained one or two knowledge on how to manage a child with ADHD. Thank you.